So I can say now. Hello, good afternoon.
Hello, good afternoon.
We'll start in a few minutes. I think we are waiting for a few more of your colleagues to join us. Can you hear us? Sarina?
Yes, I can hear you.
Mr. Balaji? Yeah, I think one thing wrong here. Don't think Balaji is there. And Santosh. Yeah. Hello, good afternoon. I'm Dr. Raju George. I'm the CEO of the Madras Medical Mission. 14th of November is the World Diabetes Day. Now, it is estimated that in India, there are around 77 million individuals with diabetes. Now, these people are between the ages of 20 and 79. And 30 to 40% of these people will end up with renal disease. 1 out of every 6 diabetics comes from India. Now you can imagine the volume of the disease that is prevalent in India. Now diabetes is a disease, if when not diagnosed early and adequate measures taken, it can affect almost every part of the human body. It is especially relevant in Tamil Nadu because 2 of the states in India which has the highest incidence is Tamil Nadu and Kerala. And these are 2 states are the ones with economically and epidemiologically high levels, economically high and epidemiologically also high in terms of health education, health promotion, and also the numbers, epidemiological data that can be collected. It is estimated that India will soon, if we carry on at this level, be the diabetes capital of the world. Now, what we notice in Triple M is although we are predominantly a cardiac hospital, we are noticing that there is an increasing trend of the patients who are coming in, increasing volume, increasing numbers of patients who are coming into Triple M also have diabetes. So what we are looking at is focusing on diabetes within the Madras Medical Mission. And today, in this press conference, I have got two diabetes specialists, Dr. Manoj Kumar, sitting on my right, immediate right, Dr. Ramanan, sitting further to the right. We have got Dr. Rajiva, who is a nephrologist, which is a renal specialist. And then we've got Dr. Ajit Mullasheri, who is the cardiac specialist. So as I said earlier on, diabetes is a disease that can affect all of these respective organs. So I'll start off with Dr. Manoj Kumar talking about diabetes in Triple M and the kind of patients that we see in Triple M.
Yeah, good afternoon to all of us who are present here. I'm Dr. Manoj Kumar Shah, working in Triple M Hospital. So what we have seen is like we get diabetes at a younger age group itself, and we get the patients are diagnosed with diabetes even at the age of 25 to 30 years. And when the patients are younger, when they're diagnosed at the early age, that brings into risk of complication also at the early age. So what we thought, let's thought to look into like what is the specific patterns of diabetes across the generation. So we did a study among our diabetic patients, and what we found that the younger generation of diabetes, what younger generation are now diagnosed of diabetes at least 10 to 12 years earlier when compared to what the parents are diagnosed of the age. And this pattern is basically attributed towards their stressful lifestyle, their altered dietary pattern, and also their altered physical activity, the sedentary lifestyle. So if we want to prevent all these things, so the only key is here, no, to have a good lifestyle modification in terms of better eating pattern, a better physical activity. Following this, we can prevent or at least delay the complication of diabetes and diabetes itself at a younger generation.
Thank you for that. One of the important things about diabetes, and which most people are not aware of, is that the feet are affected. And to talk about that, I have got Dr. Ramanan here, who will expand on how diabetes affects the feet and why it is important to pay attention to the feet. Dr. Ramanan?
Good afternoon, everyone. Uncontrolled diabetes leads to a neuropathy. So neuropathy, uncontrolled diabetes leads to neuropathy. So neuropathy where the nose is affected, so the patient may not feel the senses in the feet, which leads to a ulcer. We call as neuropathic ulcer. And in our setup, we see 80% of the patient not wearing proper diabetic footwear. The diabetic footwear is not just wearing a MCP or MCR. MCP is microcellular polymer. MCR microcellular rubber. Not wearing MCP or MCR slipper. It should be a it should have offloading, and it should have a wedge or rocker bottom. There are many footwears available to give a proper footwear to the patient. So we saw a gap between that. So we starting a setup for podiatric clinic, and we have a machine called the podiatric scan, which helps them to give proper footwear. And we advise patients once a year at least they should check their foot examination thoroughly, and also they should wear a proper footwear to avoid the neuropathic ulcer. And all the untreated neuropathic ulcer leads to amputation. As of 2016, there are 4.9% in every 10,000 patients goes for amputation. So definitely giving a good footwear and foot care will be able to avoid the amputations. Thank you.
So the study which I was talking about, it was a pilot project done in 100 patients, and we looked into the intergeneration, the specific pattern of diabetes across the generation. So what we found out that the younger generations are now diagnosed of diabetes 10 years earlier when compared to the ages that the parents were diagnosed of. And this pattern is basically attributed towards altered dietary pattern and also sedentary lifestyle because of lack of physical activity. Hence, early lifestyle modification is the key to prevent diabetes and its complication at the younger age group.
As I said at the beginning, thank you, doctor. As I said at the beginning, diabetes is a disease that affects every organ within the body. And 30 to 40% of the patients with diabetes ultimately end up with kidney disease. To talk about that, we've got Dr. Rajiva, our nephrologist within Madras Medical Mission. Dr. Rajiva.
Thank you, sir. I'm Dr. Rajiv Lochna. I'm a nephrologist out of Madras Medical Mission. So diabetes related complications are generally microvascular and macrovascular. And one of the most important microvascular complications is diabetic nephropathy or diabetic kidney disease. We see almost 30 to 40% of the diabetics having kidney disease. And the sad part about this is that most of them are silent, and most of the diabetic kidney disease is never recognized till they reach end-stage kidney disease. And the key to this is to prevent and detect it early, because now we have a whole repertoire of drugs which can be used to prevent the progression of kidney disease. And to diagnose it is easy, and at the Madras Medical Mission, our diabetologists always check all their patients for kidney disease at each visit. And that makes it much simpler because the referral is very easy. And we do diagnose a lot of people at stage 1 and 2 kidney diseases who can actually stay at that level or even kind of improve, so that we prevent end-stage kidney disease more often. That being said, the foot is also a very important part when we talk about kidney disease, because undiagnosed chronic ulcers increase the inflammation in the body, which again leads to the progression of kidney disease too. As I tell many of my patients, the eye is kind of a window to the kidney, because most of the vessels in the eye are quite similar to that in the kidney. So here we actually, most of our diabetic patients, we send them for screening for diabetic retinopathy, which is done in a matter of 5 to 10 minutes in our diabetic department. If somebody has retinopathy, we should screen them for kidney disease. Screening for kidney disease is extremely simple. It just which basically gives us an idea about the glomerular filtration rate or GFR, and a urine test to detect albuminuria or proteinuria.
Thank you, Dr. Rajiva. The heart, of course, is the most important part of our body. And without the heart, there is no life, as most people say. And we have the topmost, senior-most heart specialist with us, Dr. Ajit Mulleshevi, who will now expand on the effects of diabetes on the heart. Dr. Ajit.
Thank you, Doctor. Diabetes has two types. Type 1, which you are born young with, which is mostly a disease which starts very early in life. And type 2, which is basically what we call as the resistance of insulin in terms of trying to treat the sugar by the usage of the sugar by the peripheral organs of the muscles. So when you're talking about type 2 diabetes, which is the commonest presentation that we have here in a hospital like ours, it has a spectrum of what we call as a metabolic syndrome. Now, what is metabolic syndrome? It is a combination of sugar, blood pressure, abdominal obesity or fat at the abdominal area, and high lipid or dyslipidemic content in the blood. This combination creates an atmosphere of what we call as vascular inflammation. The inflammation is a term which is very loosely termed at times, but basically the vessels all get inflamed. And that's why you get inflammation in the peripheral vessels, which causes the peripheral vascular disease. It also causes inflammation in the heart, which causes heart disease, and inflammation in the kidney and leading to kidney disease. So the aim in diabetic management is not only blood sugar level. It is about control of cholesterol, control of sugar, lose weight, and to bring the inflammation down. So the aim in our sort of setup at Madras Medical Mission is to provide a cohesive and a comprehensive management of the patient, not only in his blood sugar, but in his management of other risk factors, and trying to delay the complications which arise inevitably because of long-standing diabetes. So this is in brief of what is cardiovascular and the whole scenario of problems with diabetes. And I think the most important theme this year, I understand, is prevention of complications by early detection and prompt action. So as a team in Madras Medical, we focus on that and try to prevent the complications which leads to inevitably bad problems like amputation of the foot, or dialysis in the kidney, or in the heart, it could lead to cardiomyopathy and heart failure, or bypass surgery or angioplasty. We want to avoid that or delay, I would say, better, and prevent the problem from reaching its inevitable poor consequence.
The theme of the International Diabetes Federation this year is to educate to protect tomorrow. So what we want to do this year on the 14th of November is to organize a walkathon to raise awareness of diabetes and its complications and how it affects every other organ within the body. And once the disease has occurred, so once the heart disease has occurred, you can't go back. So the best way to deal with it is to prevent it from happening. And health education and health promotion are the key factors which we need to address in preventing the disease from happening. I think with that, we are okay to take questions. No questions? Looks like everyone's happy with what we spoke.
I have one question.
Yeah, sure, please.
You mentioned about the pilot study on 100 patients.
Yeah.
When and what was the age of patients as such?
No, I didn't get the question.
Sorry, it was not very clear. Could you please repeat?
The study on 100 patients. What was the study period and the age group of the patients studied?
No, actually, it is an ongoing project right now, and we expect to complete it in another 6 months. And we are looking into when the patient comes in, most of the patients, they are above age of 30 years with a cardiovascular disease. And when they come to the OPD, we draw a pedigree chart of the patient to look into their diabetic status and the complication, and then look behind them and forward of them, like their parents or their offspring. And we have just completed 100 patients. That's the interim data. So probably like in another 6 months, we'll get a proper data of really like what is the duration of what is the age lost. And if we try to what we say that the diabetes is a disease from womb to tomb. So, and the key factor here is prevention. At the early onset itself, if you're able to prevent diabetes, it is going to benefit the patient. If the patient already has diabetes, then the idea will be like to prevent the complications. Like as Sir said, prevention is the key. So when pre-diabetes, we are preventing the patient from getting to diabetes, and from diabetes, we are preventing the patient from getting into complications. Now, if a patient already has a complication, like what we have got in a hospital, like cardiovascular disease or a kidney disease, we all know that diabetes can affect each and every organ. So the idea will be to prevent the complication of other organs also. Like if the patient already has got a cardiovascular disease, our aim is to prevent the kidney disease or the amputation. So at every stage, we need to prevent the patient from going into the next step forward. So that was the idea what we started with this study on, and our idea was to like target the younger generation. Like we saw the 10 years before, So if you can target the younger generation for taking the preventive measures, it will prevent them from getting into the disease or its complication later on.
The study that we are currently doing is a prospective study. In other words, we are following up patients. To give you an example, last week or the week before, we had a patient who came in. He was a cardiac patient, but with diabetes associated. And unfortunately, because we couldn't detect the extent of the disease in the leg, the patient had to lose one of his legs. There was a below knee amputation. So what we want to do within Triple M is to prevent incidences like this happening to our patients by detecting the disease quite early, and especially with podiatry, looking at legs, preventing the amputation and stopping the disease getting to that stage.
We also did one education what we did to our patients when we found them about the pedigree chart. We told them that your children will be what you are. So if you start doing physical activity or following a proper diet pattern at the initial stage, your children will start following them early itself. And then thereby at the gift what you can give to your children is not the property, is a better healthcare. So a better lifestyle modification at your teenage itself for the children, that will help the child to develop a healthy lifestyle. And when they enter into the adulthood, they will be at least free of all this disease and complications, all this lifestyle disease, like be it your diabetes, hypertension, dyslipidemia, or cholesterol problem, or obesity. All this can be prevented when a child follows a proper healthy lifestyle at the early stage.
Doctor, just adding on to Serena's question, you were talking about, how the disease hits people 10 years early. So if we take the previous generation, probably they had the disease in their 50s, when the Western population, it affected them in their 60s. So with what you are saying, can we say that the disease now affects people in their 40s? Compared to the previous generation. The previous generation was at risk from 50s. Can we say the present generation is at risk for diabetes from the age of 40s? Is that what you're trying to say in your study?
Yeah, even 40s.
In the interim study.
Yeah, even 40s, even it can be early to 40s also. And the more you spend your duration of diabetes at your age group, the more risk of complication you get. So if, for example, a man getting diabetes at the age of 60, he will be another 20 to 30 years. So only 30 years will be with diabetes with controlled or uncontrolled. But if a man gets diabetes at the age of, let's say, 40, he has got extra 20 years where he'll be living with diabetes. And if at that time, if his sugars are not controlled, he will get the complication of it.
Can I come in on that? To look at, to answer your question, India is becoming a fast developed country. And unfortunately, we are copying the lifestyle of the Western countries. And also, if you look at heart disease is also increasing. Likewise, diabetes is also, food habits are increasing. To give you a simple example, every household now in India has got a two-wheeler. If you look at 10 or 15 or 20 years ago, we didn't have that luxury, and we spend more time walking and getting more exercise. Now, in a highly motorized society and educated society, we have all those luxuries. So access to exercise, which is one of the key things in diabetes, is now being lost. And that's why the incidence of diabetes is getting lower and lower within the age group. More and more younger people are getting diabetes as opposed to 20, 30 or 40 years ago.
Trying to see, for example, I'll tell my own thing. So when I am 5 years or 6 years age, if I want to have a chips, my grandma used to potato chips. When you say one week process, they'll all dip in the water and they wait, and they have, it takes minimum 3 days to get a chip. Nowadays it's not so. If I have 10 rupees, immediately I'll get a chip. So the lifestyle, the junk food, or the children, from the age of 4, they were eating a lot of junk food. Oh, see, you take whatever food except what food made from our home, everything has got so much of, especially canned food, it's got so much of sodium and oil and also sugar. So these things are very, very dangerous for our health. So definitely we should avoid the junk food, and also we should have a regular what do you say, exercise. That is very, very important. So
To answer to your question, yes, the answer is yes. We are diagnosing diabetes almost 10 years earlier than what used to happen before.
And this 10 years you can utilize it to educate the younger generation. So that
So
at least in future.
we can say people in their late 30s and early 40s are getting diabetes, which is 10 years ahead of their parents.
Yes.
Is
Yes,
that
indeed.
correct?
Yes, that's correct. Any other questions? Dr. Ajit, would you want to wind up by last few words?
Okay, just to conclude what the discussion was, that we are the diabetic capital of the world, very close as China, but I think we are going to overtake that very quickly. We are facing a double whammy of infectious disease and non-communicable disease, which is basically diabetes and metabolic syndrome and the consequences of that. We are seeing it earlier and more often in our practice or in the hospitals and outside hospitals. We need to act quickly, act more aggressively, when I mean in promoting physical activity, promoting good eating, and promoting healthy lifestyle in general. Urbanization is a stress, which is a natural consequence of development, and economic development leads to non-communicable disease. This cannot be changed. This cannot be reversed. This has happened all over the world. What we can do is slow it down. And for this, we need to act in a group with prevention as an important issue. Let me tell you, the most important organ is the two legs that you have, the 2 feet. If you keep walking, many of the disorders will come down. The feet is the largest vasculature system, the largest muscle body. If you develop your legs well, you delay all lifestyle disorders. If I can simply tell my patients, tell your children to play games, to run around. Unfortunately, today's schools are not having a playground. They only have rooms to sit and learn. Get onto their feet, play some games, run outside, and as you grow up, then start a physical program early and prevent the eating of food, which is unhealthy, which is basically high sugar, high oil, and processed foods and processed sugars, which are the problem for diabetes. So we in the Madras Medical Mission seek to follow the IDF recommendation of prevention as the stepping stone of delaying disease, which is lifestyle based, including diabetes and cardiovascular.
Rajesh, Gopi, Balaji, Serena, and Pushpa, I think you have a very, very vital role in spreading the message of prevention and healthy eating and exercise. So thank you very much for joining us in this session on diabetes, and look forward to hearing from you pretty soon. Thank you very much.
Thank you, sir.